this is our collaboration example is essentially trying to make short-term effectively long-term. But the idea is that it's still a number of short-term experiences that come down and share. I posted this photo because, individually there's not much that we can lift, but if you have a whole team lifting your team leader, then you can actually lift them. So, like I mentioned, what we started out as, and this is like a bit of our story and how we got interested in this topic. We started out providing medical care, and like I said, we're recovering volunteerists from that sense. When we first started going down in 2006, and after a few trips, we were just kind of like, what are we doing, right? Like, what are we really doing when we just go down and see a bunch of kids over a week? And essentially, what happened there, we noticed also a lot of duplication and waste with the other groups, right? We also didn't realize that there were other groups that went down there until we talked to the local leadership. But then, so we came up with, as I mentioned, the web-based collaborative platform. And together with that, we started having monthly teleconferences, both with the local leadership and local partners that we have down there, as well as with all the other teams. And we're talking about more sort of systems-level interventions that the teams can actually handle, and that can be passed on from team to team. The question is often asked, did it work? Well, our web-based platform went online in January. But some of the outcomes that we've seen, as I mentioned already, is there's definitely a lot more local input and leadership. As I mentioned, because they're not just necessarily, trip logistics coordinators anymore. They actually, because a lot of teams just crowdsource the information they need from the website, they're able to actually provide more input into the programs that they want to see implemented, the projects that they want done. We share resources and data now. In fact, we're actually in the midst of doing an extensive chart review for a bunch of patients that we're seeing, with some other medical trips. And we're trying to establish some baseline trends of disease in the community. There is continuity of care in this sense as well. So in terms of primary care, you go down there now, and if there's someone you want followed up on, you just let another team, know in a few months, kind of thing, to follow up on that person. There's reduced duplication of efforts and waste, greater community advocacy towards more upstream goals. So within the web platform, promoting sort of systems level thinking instead of downstream thinking. And then ultimately, population health change. Well, it's early on to say, but we're going to be conducting a formal evaluation soon. So, our next steps, basically, as I said, everyone's talking about problems. These trips are horrible. Short-term trips are bad. But now it's time to talk about solutions, right? And so that's what our organization is trying to do. We're open to any ideas. We're flexible. But basically, it's try to advocate, try to educate, try to innovate, recognizing that we believe in harm reduction in a way of short-term trips, right? And essentially back to the parallels of alcohol. We once talked to a few other people. We do like sort of focus groups and discussions with students, and I was at McMaster University actually. We did a focus group with them, and one guy said he will always want to go abroad and do one of these trips. It's the way that he says that he feels he can help. And I think the only way you're going to stop people like that is if you shut down the airport. So if they're going to go, we need to figure out an innovative model to make this work somehow in an ethical and responsible way.